everyone, I am Nola Destin of a Class 2I Nursing program study the 3 Nursing Poltekkes at Tasikmalaya. I will present the journal article written by Satria Paranata entitled The Implementation of Diabetic Self-Management in Indonesia and Taiwan Hospital, a case study design. Every year, people with diabetes mellitus are increasing. Nearly 425 million people in the world have diabetes mellitus. In Indonesia, about 183 million people have diabetes mellitus, and in Taiwan it has remained stable for the past 10 years. With that, the right approach is needing by health workers so that diabetes get their blood sugar stability. Important did this study so that the patient disease burden can be reduced. Then, this study was conducted to analyze the self-management of diabetes mellitus among the hospital population in Indonesia and in Taiwan. Next, to develop a theory-guided and evidence-based nursing model in self-management in diabetic patients with practical problems. The research is method in the form of supervision, discussion, in-person interview, observation, and evaluation based on the running project plan obtained during the activity. Based on guidelines of clinical running plan on study activity report. HL Hospital Abdul Qadir added to analyze the healthcare problem of the population of type 2 diabetes mellitus. Then, explore the development of knowledge and practical situation about patients with diabetes mellitus. Self-management, influence factor in self-management. Analyze the advantages and disadvantages of the current self-management model. Next, the population and sample of this study were 10 patients who were included in the criteria for the inclusive interview using questionnaires self-management. Diabetic self-management, self-efficacy scale, diabetic self-management, knowledge, and diabetic distress scale. Likewise, nurses, nutritionists, participants in being interviewed to get information in self-management. That, how we collect the data. Identify perception of self-management perspective and observe how to facilitate self-management in diabetic mellitus patients. This research has been approved by the hospital with letter reference number 1243 HPL 119. The medical personnel participants in this study who will later be given question, then given questionnaires to help with the research. In order to gather the data, we need to interview nutritionists, doctors, and nurses. Before completing your data collection, we gave an informative closure. The data feature analysis using the Wakana analysis. At HL Manambai Abdul Qadir Hospital, Indonesia, divided into self-management of diabetes mellitus patient. Health education system related to self-management. Self-management perspective based on nursing, doctor, and nutritionist. Evidence-based nursing practice and health education related to self-management among diabetes mellitus patients, as well as how to facilitate self-management to diabetes mellitus patients. With observation in Indonesia, we can directly ask the patient because there are no obstacles in the language regarding the needs of self-management with the ratio sent from the following table. Most of the 60% self-management include poor patients, although patients were diagnosed at about 70%. Patients admit that they regularly consume the traditional herbal medicine China, which expect their blood sugar to remain stable. Patients are always routinely checked with a doctor so that the doctor always knows his condition. Next, with this recognition, patients with diabetes mellitus always follow the advice of doctors and nurses. They also follow the advice by doing a healthy lifestyle with a diet and diligent exercise. But there are also patients who manipulate their diet by setting a schedule. For example, if they want to be checked by their doctor one day in advance, already planning a diet, so that the patient's blood sugar results are stable or good. Proven done with the can be concluded that the blood sugar examination for has not been the best laboratory examination for a patient in the hospital. Most of the patients did not realize they had diabetes mellitus, which they knew that suddenly they were sick and hospitalized, and suddenly the condition was severe. But there are some patients who don't experience complication. Patients who have a good knowledge of diabetes alone, 30%, then others 70% are in the moderate but to very bad ranks. Taipei Veteran Public Hospital found in 4 aspects. 1. Diabetes mellitus patient need self-management. To find out the patient need for self-management, I did it directly with the interview. I'll talk a little bit of a language of title. As a result of this interview, I believe self-management among diabetes mellitus patients has been good in general. I don't find patients with complications like kidney health disease. 2. Health education system related to self-management. This system is called Shared Diabetes Care, and it is the standard system in the Diabetes Association and Taiwan government. In another diabetes care sharing system, Veteran Hospital also uses ECT-based smart healthcare system to support self-management of diabetes mellitus patients. While at home, patients can take pictures of every food they have consumed on a daily basis or measure blood sugar, then upload image or result of the web system. Any information provided by the patient will be integrated with the information system platform in the hospital automatically. Nursing educator, nutrition, and doctor can directly control a patient condition through this system and can provide advice online. 3. Evidence-based nursing and health education related to self-management among patients with diabetes mellitus and how to facilitate self-management for diabetes mellitus patients. In general, the guidelines contain examination, intervention, and the types of information provided to diabetes mellitus patients. 4. Small group discuss with support group. The implementation of the educational process is not only indoor activities, but also outdoor activities. Outdoor activities are simple exercise that they can do well at home. From the research can be said to be in line with previous research. And it can be concluded that, first, self-management will be success if there is support from hospital and a good health system. It might take a long time to change the large system that exists in a clinical setting. 2. Good communication from health workers will be able to increase the patient motivation to be able to do self-management. Gratified needs training is like training diabetic educator to make everything more organized. 3. Great equipment laboratory tests, sympathetic skin response tests, pulse volume recording tests. With international standard is also very important to support self-management system. 4. I will organize an easy health insurance system so that it can accommodate all the needs of the diabetes mellitus patient or community on healthcare needs. It takes political power to make this challenge a success. Without a good system in the hospital, good communication between health workers and patients, equipment support, and political power from the government, self-management will very difficult to be successful. and knowledge participating in this study were hospital, especially nursing, doctor, and nutritionists.